This slide is about micro. Micro is the antonym of macro, the opposite. And micro means tiny or small. So in this first word, we have my crow, foul, ick. Microcephalic. And in the second word, we have my crow, an, g, op, the. Microangiopathy. Microangiopathy. First one, we have micro. We have it over here as well. The root in this one is ceph. The root in this one is angio. And the suffix we haven't really talked about. Actually, I'm not going to call it a suffix because it is in itself a root, but we'll talk about that in just a second. Okay, micro means small or tiny. Ceph, remember the first one that we talked about, cephalgia, was headache. Ceph refers to head. So microcephalic means having a small head. Some babies are microcephalic, meaning their heads are smaller than what they should be for their ages. And that is usually, in my experience at least, indicative of underdevelopment of the brain. The brain just has not developed as it should. So when I hear microcephalic, I think of infants with abnormal brain development. This one is one that I'm more familiar with because I have seen it in autopsy cases at least. Microangiopathy. Pathos is disease. Angio is vessel, blood vessel or lymph vessel. In this case, blood vessel. Small blood vessels are called capillaries or capillaries. And when capillaries get to be diseased, there is a condition called SVD or small vessel disease, where the walls of the capillaries thicken, and so those vessels become diseased, and that can lead to serious issues. So microangiopathy is the same as SVD, small vessel disease. The large vessels are arteries and veins. Capillaries join arteries and veins sometimes. They're where gas exchange occurs. Some capillaries are so small that a single drop of blood cannot easily pass through. That it can pass through, but they're tiny, tiny vessels. And that's where this disease occurs. So think of small vessel disease. You don't want those vessels to thicken, or that space gets even tighter for a single drop of blood.